Hi, I am Alexis Nancino from BSN 2A.
Good day everyone, my name is Shalimar MO2 from BSM 2C.
Hi, I am Angelica Beltran and we are the second year student nurse. So this content is all about the drug discussion, which is the morphine. So morphine is used in pain management, provides significant relief to patients afflicted with pain. It is important to discuss this drug to provide total knowledge about the uses, the side effects, and the indication of these drugs. So the drug that we will be presented is a narcotic opioid or pain reliever drug, which is the morphine. Morphine has available under the following different brand names, which are the MS Contin, Astramorph, Depodor, Doramorph, Enfomorph, Cadian, and Morphaban. Morphine belongs to a class of drugs known as the narcotic analgesic. So the indication of this drug is FDA-approved usage of morphine sulfate includes moderate to severe pain that may be acute or chronic. Most commonly used in pain management, morphine provides significant relief to patients afflicted with pain. Clinical situations that benefit significantly by medicating with morphine include management of palliative end-of-life care, active cancer treatment, and vasoconstriction pain during sickle cell crisis. Morphine is widely used off-label for almost any condition that causes pain. In the emergency department, morphine is given for musculoskeletal pain, abdominal pain, chest pain, arthritis, and even headaches when patients fail to respond to first and second line agents. Morphine is rarely used for procedural sedation. However, for small procedures, physician will sometimes combine a low dose of morphine with a low dose of benzodiazepine like lorazepam. So the morphine can decrease heart rate, blood pressure, and venous return. Morphine can also stimulate local histamine-mediated processes. In theory, the combination of these can reduce myocardial oxygen demand. So the morphine administration can occur through various vehicles. Its administration is most often via the following routes: orally, intravenously, epidural, and intrathecal. Oral formulations are available in both immediate and extended release for the treatment of acute and chronic pain. Pain that is more severe and not well controlled may be manageable with single or continuous doses of IV, epidural, and intrathecal formulations. Infusion dosing can vary significantly between patients and largely depends on how naive or tolerant they are to opioids. It is interesting to point out that IV morphine formulation is also commonly given intramuscularly. Morphine is also available as a suppository. Morphine is widely used and abused. As a result of this, people have found ways to insufflate the medication. Morphine is also available as an oral solution and can be administered sublingually. Sublingual morphine is very popular in palliative care. This drug is prescribed when other pain relief medicines are not effective and cannot be used by the patient.
Mechanism of action of the morphine. So how does the morphine work in the body? The central nervous system's opioid receptors are the primary site of action for the morphine by blocking the nerve's ability to transmit pain signals from the body to the brain. It also lessens the perception of the pain. Morphine has an affinity for delta kappa and mu opioid receptors. This drug produces most of its analgesic effects by binding to the mu opioid receptors within the central nervous system, or what we call CNS, and also in the peripheral nervous system, or what we call PNS. Principal opium alkaloid acts as against at specific opioid receptors in the central nervous system to produce analgesia, euphoria, and also sedation. Opioids have an onset action that depends on the route of administration. Opioids causes hyperpolarization of nerve cells, inhibition of nerve firing, and presynaptic inhibition of transmitter release. Cellular effects of these drugs involve enhancement of neuronal potassium efflux, like hyperpolarizes neurons and makes them less likely to respond to a pain stimulus. And also inhibition of calcium influx. It decreases neurotransmitter release from neurons located along the pain transmission pathway. Also, brainstem opioid receptors mediate respiratory depression and produced by opioid analgesics. Constipation results from the activation of the opioid receptors in the central nervous system and in the gastrointestinal tract.
Describe common condition and medication treatment. Morphine is used to relieve severe pain such as pain caused by a major trauma, for example like accident, surgery, labor pain, cancer pain. Morphine should only be used when the other forms of pain relief have not been successful in managing pain, or if you're not able to take them, for example because of side effects, or because your doctor says you cannot take it together with another medicines that you are taking. Morphine includes moderate to severe pain that may be acute or chronic, mostly common in pain management. It provides significant relief to afflicted with pain. So here are some scenarios. For example, to labor pain. If the mother cannot take the pain anymore, the nurse gives morphine to provide major relief to the patient to lessen the pain he was feeling. For major trauma like accident, morphine reduces feelings of pain by interrupting the way nerves signal pain between the brain and the body. Explain common dosage forms and their frequencies. These are the common dosage of morphine. Morphine tablet. 15 to 30 mg come in two forms, immediate release and extended release. This form is typically prescribed to be taken every 4 hours. These tablets usually begin to kick in within 30 minutes of consumption, reach their peak effects after about 1 hour, and continue to work for approximately 2 to 4 hours. This is usually used for if the patient is experiencing short-term or mild pain. Morphine capsule. This type of morphine is only available in extended release formulation. And depending on the situation, a patient may be required to take it every 8 to 12 hours or every 24 hours. Just like extended release tablets, the capsules are not meant to treat pain that is successfully managed by NSAID or short-term pain such as post-op pain. Another important thing to keep in mind is that they shouldn't take when needed but more on scheduled basis prescribed. And lastly, morphine liquid solution. This morphine liquid solution should be taken orally and is intended to treat both acute and chronic pain. It can be prescribed in various dosages and should be taken exactly as your physician has directed to you. If you feel that your dosage needs to be altered, you should speak with your doctor and they will adjust the prescribed dose if needed. This formulation of the medication will begin relieving your pain approximately 15 to 30 minutes after you take it. Its effect will peak about an hour after ingestion and last for rough 2 to 4 hours, depending on the type of pain that you are suffering from it.
The side effect of morphine. Morphine, a powerful opioid analgesic, is commonly used for pain management. While it can be effectively alternative pain, it may also lead to very side effects. Individual response to morphine can vary and not everyone will experience all those side effects. Commonly side effects of morphine include respiratory depression. One of the most significant side effects is respiratory depression, which involves slow or swallow breathing. This effect is dose-dependent and can be particularly pronounced at higher doses. Nausea and vomiting. Activation of chemoreceptors trigger soon in the brain can lead to nausea and vomiting. Anti-nausea medication might prescribe along morphine. Confusedness of cognitive impairment. Morphine can affect cognitive function, leading to confusion or dizziness, particularly in older adults. Euphoria or dysphoria. Opioid-like morphoria can include feeling of euphoria in some individuals but also cause dysphoria or mood changes. Urinary retention. Morphine can interfere with normal bladder function, leading to difficulty in urinary or urinary retention. Hypotension. Morphine might cause a drop in blood pressure, resulting in hypotension. This effect can be more pronounced when standing up and potentially causing dizziness or fainting. The precaution of morphine: do not take too much of this medicine or take it more often than your doctor tells you to do. This can be life-threatening. Symptoms of an overdose include shrimp, dizziness or weakness, slow heartbeat or breathing, seizures, trouble breathing, and cold and clammy skin. Here are some situations in which seeking medication help with morphine might be considered. Moderate to severe pain. Morphine is often prescribed for moderate to severe pain, such as associated with surgery, injury, or certain medication condition. Post-surgery pain management. After certain surgery procedure, especially those that might result in significant pain, morphine or other opioid might be used for a limited duration to manage acute post-operative pain. Terminal illness or palliative care. Morphine is commonly used in palliative care to manage pain in patients with terminal illness, which cases the goal is to ensure the quality of life by providing effectively pain reliever. Here the tips and safety. If you have been prescribed morphine for pain management, it's crucial to follow your healthcare provider instruction carefully. Here are some tips for patients taking morphine. Follow prescribed dosage. Take morphine exactly as prescribed by your doctor. Do not increase or decrease the dosage without consulting your healthcare provider. Take it on schedule. Morphine is often prescribed on a scheduled basis. Take it at the same time each day to maintain a consistent level of pain reliever. Do not skip dosage. If you miss a dose, take it as soon as you remember. However, if it almost time for your next dose, skip those misses one and continue with your regular schedule. Do not double up on doses. Understand the side effect. Be aware of potential side effects such as drowsiness, constipation, and nausea. Report any usual or severe side effect to your healthcare provider.
Here are some key points that you can take away. Morphine is an opioid medicine prescribed for severe pain. Other pain relief medicines are not effective or cannot be used. If you take morphine regularly, stopping suddenly can cause withdrawal symptoms. Always take morphine exactly as prescribed by your doctor. If your pain is not well controlled by morphine, or you have any unexpected or unwanted side effects, see your doctor. There are several different forms of morphine available, including immediate and extended release tablets, extended release capsules, and a liquid solution. Each different type of morphine is available in several different dosages, and yours will be determined by physician. Morphine has a high risk of overdose anytime that it is abused or used in any way other than instructed by the prescribing physician, regardless of the form it comes in. Morphine is not intended to be used during pregnancy and should not be combined with alcohol.
Before taking this drug, it is important to take this medicine only as directed by your doctor. Do not take more of it, do not take it more often, and do not take it for a longer time than your doctor ordered. That's all. Thank you and God bless.